So I farm so hard, the employees wanna find me, and then wanna hire me. What's 100K to a guy like me? Could you please remind me? Farm so hard, this ain't easy. Working late nights, you best believe me. My grades can only go A's. Never wanna see another B unless I'm Jay-Z. Farm so hard, let's get paid.
Hey, what's going on, everyone? This is William, clinical pharmacist, and I'm here with Jimmy, and we're going to be breaking down a new medication called Journavix. This is the first non-opioid pill for moderate to severe acute pain that's been approved in over 20 years. And to give you a little bit of perspective, the last pain medication that was approved was Celebrex, and this is a non-steroidal anti-inflammatory drug.
Yeah, this is super cool because, again, we haven't really had anything in the ER for quite a while, and this is going to be for acute pain. So, of course, this really caught my interest. So, this is something that's going to work within 34 minutes. So, this is something we probably should give a rapid reaction to. And before I move on, dosing of it. They had a loading dose in their studies of 100 milligrams followed by 50 milligrams Q12. So, I just didn't want to forget that as we get to talking about other stuff. Go ahead, William.
So it's pretty exciting to see another option for patients that's been approved by the FDA. So let's nerd out a little bit with the science and the mechanism of action of this new medication. So Journavix is in the class of medication that blocks a specific type of sodium channel. And these sodium channels are found throughout the body, but specifically the new medication is targeting those in the peripheral nervous system. So that's outside the brain and the spinal cord. And these channels allow neurons to fire signals. And this particular sodium channel is called NAV 1.8, and Journavix targets this particular sodium channel. So this is in contrast with our other medications that we have, like bupivacaine or carbamazepine, which are considered non-specific sodium channel blockers. So these are medications that block sodium channels within the CNS. So this new medication essentially avoids the side effects that can be seen with medications that target the sodium channels within the CNS, right? So if you don't have any brain interference, you can possibly avoid that addiction risk that we see with opioid therapy.
Yeah, well, so I think that was a pretty good breakdown. And for me, I always like to really focus on how can I compare a new medication to something I'm already using? And to me, especially in the ED, this really gets to where we starting to use lidocaine for renal colic and some of these other type of conditions, and we saw a benefit there. You're hitting this NAV receptor, these sodium channel receptors. That really gets to me as a very hyper specific sodium channel blocker that helps with pain that we can give orally, but also we've kind of tweaked it a little bit to be able to block the CNS penetration to stop all of the additional things and the side effects that we tend to worry a little bit more about. But for me, it just gives me an oral form of lidocaine, and that's something for me I think some of my ED people can really hone to when it comes to this new drug. Again, something we really hasn't had in quite a while. So I thought that can be a game changer in a sense of it's something new, and I think we'll talk about the studies in a second as far as what does it work compared to? Is it better than placebo? Pretty sure, but some of the other things as well, again, is the side effect profile. So this is a really intriguing drug to me so far. But go ahead and tell me a little bit more about the studies.
So let's switch gears and dive into the two big studies that we're seeing for this new medication. So this medication, Journavix, was utilized for acute surgical pain patients after tummy tucks, abdominoplasty, or foot surgeries, bunionectomies. And in each of the randomized studies, we saw patients receive either Journavix, placebo, and also Vicodin 5-325 as well. And to note, ibuprofen 400 milligrams was also used as a rescue medication as well. In the studies, we saw that Journavix was statistically significant versus placebo, but it's also important to note that it did not show that it was more efficacious versus a 5 milligram Vicodin pill. Right, so this is very important to note because this new medication is really not going to be all of a sudden a replacement for a fentanyl patch for a cancer patient, or say even a PCA for a sickle cell patient in severe vaso-occlusive crisis, right? But this does give us another option in our toolbox that we can use for patients. And I'm definitely looking forward to real-world outcome data as well in the future. Jimmy, what are some of the side effects and drug interactions that we should watch out for with this new medication?
Yeah, one of the things that we want to look out for is always going to be side effects, especially with these newer drugs. And this one here, again, is unique because we've never seen a drug like this in the oral form in widespread use. So I'm always wanting to kind of take a step back and look at the studies, what they found. One of the key things I thought was pretty intriguing, they found pruritus, muscle spasms, increase in blood creatinine, phosphokinase, and rash. Those were the big side effects. To me, that's, again, very different than CNS issues and some of the other CNS depression. And it really lets me know that their mechanism, again, may have something to it as far as not causing that somnolence. And I was intrigued that we didn't necessarily get the big nausea and vomiting diarrhea component of all this. It does go down 384. So for me, it makes me want to take a step back and look at all the other drugs we're using, especially our big time CYP3A4 inhibitors, and making sure that we're not causing this drug to get super elevated. And then you have your inducers as well. You have to be very conscious of. Again, most of the drugs go through this pathway, and it's something that we're looking at as a pharmacist to begin with. But I thought it was a really intriguing side effect profile to me. But of course, with these newer drugs, there's also other things you got to look out for, like price. So William, go ahead and tell us a little bit more about the pricing of the drug.
As far as the price of this medication, it's looking like it's about $15 per pill. And this is a lot pricier than some of our current generics that we have on the market for pain. But used for short-term post-surgery or injury pain, insurance may possibly pay for it, but that's one thing about any new medication that gets approved. The next issue is actually having patients get access to it and it be cost effective for the patients who need it. We'll see in the future what happens with that.
Yeah, William, the cost thing is going to be a huge concern, to be honest. And that's what comes up with every medication. But for me and ED, it's really a compounded effect because, again, a lot of my patients already have access issues. But when we're looking for something that's going to be a fast, potentially a safe option, this is exactly what it is. It's going to be an option. And it can be something for widespread use because, again, the whole non-opioid pain components have come out there. But if it's something that works well, and the studies, again, at least initially says that it worked just as good as using like hydrocodone acetaminophen, $15 is a ton for a pill compared to some of the generics out there. And as you mentioned before, the big thing is not necessarily do I think it's going to be valuable, it's going to be cost effective, but does the insurers really find it to be costly and effective? Because I look at it as we can really look at it and compare the side effect profile and what happens from that. We're comparing it to opioids, so again, that's going to be the thing we compare it to. Is it going to be reducing hospitalizations and respiratory depression and all the bad things that potentially could happen with ineffective use of opioids? And could it be cost saving in the long run? That's an insurance problem. That's a managed care problem. Again, but like you said, again, this really comes down to how reimbursement plays out and whether this is something that we can use as a more of a go-to option as part of a package potentially, or stays as a more of a niche therapy for post-surgical patients that have a little bit more financial options. For me, I have to look at it and say, hey, if the insurance is not covering it, I have to really be honest with my docs and the patients and say, hey, this may be tough. But some of our patients really want that. Some of our patients who are on medications to prevent them from getting on opioids, this is, again, exactly what it's supposed to be, an option. So it's intriguing. Again, newer option, something we haven't really had out there for a while. But again, I think it's something that we should at least be aware of.
But it's also important to remember Journavix is for acute pain only. At the moment, for example, post-op pain, there are ongoing studies with this medication being looked at for chronic neuropathic conditions and also lumbosacral radiculopathy as well. So we'll see what kind of efficacy that this medication will have in these conditions as well.
All right, so that distinction is really clear. Right now, it's going to only be for short-term pain, and that's what got my interest, to be honest. ED is going to be focused on short-term pain for most of our patients, unless we're just helping out from the chronic condition. And there's other studies out there, like William said, they're going to be looking at chronic neuropathic pain. It's giving us different options. But until that stuff comes available, I'm really intrigued with seeing what happens now. It's definitely FDA-approved. It's going to get utilized. It's going to get studied in the real world. And I'm intrigued to figure out what this actually looks like. Because again, the initial, phase 2 and phase 3 study is going to be great, but how are people actually using it? And it's something that I'm intrigued with, not something that I'm going to just quickly jump on board with, but this is a new tool. And we have to figure out how to use this tool. And that's what I'm going to spend most of my time looking at now. Exactly how to use this tool, what patient population, was it going to be something I use when I have my ER hat on or when I'm doing other work outside the ER. So I think it's very intriguing, but I want to see what you guys think, whether you guys are in different places outside of the ER, if you're pain management, oncology. I want to hear what you guys think. So if this was a decent video to help you understand kind of the mechanism, the studies, let us know and drop your comments in the comment section. So intrigued with this whole concept, and we'll be looking at this as new data come out. So William, thanks you for joining me on this one here on this rapid review for this new medication.
Closes it. Ozzy scratches his head. Whatever she's looking for, it isn't in there.